Demi Moore has captivated audiences for decades with her timeless beauty and unforgettable performances. But as with many stars in the limelight, rumors swirl about the secrets behind her seemingly age-defying appearance. Let's take a closer look at Demi Moore's facial evolution over the years, examining the speculation surrounding whether she has undergone plastic surgery to maintain her stunning looks. The costs of her potential procedures are revealed towards the end of the video. In 1981, at the age of 19, you can see that Demi has high, full brows. She has these big, open eyes, and she has a non-bulbous tip. I know that some of you comment that I always say that everyone has a bulbous tip. Well, in this case, Demi does not have a bulbous tip, in my opinion. Her mid-face and her lower face have a strong bony structure. Demi has well-defined philtral columns, and she does appear to have a thinner upper lip. In 1982, at the age of 20, I would like to point out here the natural boundaries for the eyes, the mouth, and the cheeks, and what happens when we overfill with filler, these boundaries get blurred, and you'll see that as time goes on, there are some blurred boundaries that occur with Demi's face. In 1983, at the age of 21, Demi has a slight dorsal convexity, which is a small bump on the bridge of her nose. But this does not take away from the beauty of her nose. In 1984, at the age of 22, I see no change, and that's the same through 1985. In 1986, at the age of 24, I'd like to point out the upper tooth show that Demi has on repose. When she parts her lips, you can see quite a bit of upper tooth show, and this is generally a more youthful, sensual type of look. It appears to me that Demi may have had a brow lift around this time. The brow is now positioned above the brow ridge, and this persists for many years. In 1987, at the age of 25, when you look at Demi's central hairline, there appears to be a thinner area there, but that is where her natural part line is. And everyone at the natural part line will have a thinner appearance to their hair. Some people come to me asking for a hair transplant to thicken up an area like that. But the problem is that even though you can get it a little bit more dense with a hair transplant, it'll always appear to be the thinner portion of your hair. And that's because the hair is going in opposite directions. If you try to transplant in a different direction, then you start to lose naturality even though you've placed more grafts into the area. So there's a limit to how much thicker you can make a natural part line appear. In 1988, at the age of 26, I see no change, and that's the same through 1989. In 1990, at the age of 28, I wanted to point out here the excellent jawline definition that Demi has. And a lot of that is attributed to the strength of her mandible, or the lower jaw. In 1991, I see no change. And in 1992, at the age of 30, there is lateral brow descent. And that is because she's now in her 30s, and that's a very common time for the tail of the brow to start to sag, even though it's very slight. In 1993, at the age of 31, Demi's face is starting to appear fuller, and this is likely because she was pregnant around this time. In 1994, at the age of 32, I see no change, and that's the same through 1998. In 1999, at the age of 37, you can see that her nasolabial folds are starting to deepen as the aging process is ongoing. In the year 2000, at the age of 38, I see no change. In 2001, at the age of 39, you can see the temporal hollowing that's starting to occur. And this is an area that can be filled, but you have to be very careful not to overfill it, because if you have the temple region starting to protrude more lateral than the lateral cheeks, things start to look very artificial. In 2002, at the age of 40, it looks to me like Demi may have started to do some Botox around this time, and this is to the usual areas, the forehead, the glabella, and the crow's feet. In terms of dosages, usually the forehead will take about 15 to 20 units. When it comes to the glabella, you're looking at about 10 to 20 units depending on the strength of the muscle. And when it comes to the crow's feet, a standard dose is about 20 units combined for both sides. In 2003, at the age of 41, I see no change, and that's the same through 2005. In 2006, at the age of 44, you can see some early signs of cheek descent, and this is in part due to gravity and in part due to volume loss that occurs as we age. You can also see that Demi now has some neck skin laxity that is forming. In 2007, at the age of 45, I see no change, and that's the same through 2009. In 2010, at the age of 48, I wanted to point out that Demi has flawless looking skin. And part of that has to do with protecting your skin from sun damage and a lot of sun exposure. So using sunscreen regularly is very important. And of course, basic skincare, such as using a facial moisturizer, a facial cleanser, and like an HA serum is very good for maintaining excellent skin. We have some of those products available on the Feel Confident website, so make sure to check that out at feelconfident.com. In 2011, at the age of 49, I see no change. In 2012, at the age of 50, I'm seeing some signs of an upper blepharoplasty. This is a procedure that removes some excess upper eyelid skin, and what it tends to do in some patients is to cause some degree of hollowing of that area under the brow ridge. So you can see that occurring in Demi's case. So while the eyes might look more youthful in that they become a bit more open, that area up above, as it becomes more hollow, can actually cause a more aged type of appearance. In 2013, at the age of 51, I see no change, and that's the same through 2015. In 2016, at the age of 54, I think this is where Demi may have started to get some cheek filler. When you compare back to, say, age 21, you can see how the cheeks appear more full, especially in the medial section, closer to the center of the face. And this is where I find a lot of people over-inject. They put too much emphasis on that medial cheek. They create a heaviness here and oftentimes might under-inject the lateral cheek. So what you get is an appearance that doesn't exactly match the more youthful version of the person. And adding filler to the medial cheek can sometimes contribute to the appearance of aging, because as we get older, the volume starts to get more emphasized in the medial region as the cheeks come down and in. In 2017, at the age of 55, I see no change, and that's the same through 2018. In 2019, at the age of 57, you can see that now with Demi getting filler into the medial cheek, especially over the course of several years, there's now this overinflated appearance. And when we compare back to a similar angle from, say, 1990, you can really tell that there has been a significant change to how her face looks now compared to when she was younger. And it's not just because of aging, it's because of the introduction of filler. Remember that filler doesn't often just dissolve on its own, as we were told when filler first came out by the different companies that make them and by many of the providers that inject them. We now know through various MRI studies that these fillers, these HA fillers in particular, tend to hang around and they can migrate and they can move into other parts of the face as we get older. So they can be dissolved, but oftentimes they tend to build up over time and start to distort the face to a degree. In 2020, at the age of 58, I'm seeing some introduction of potential lip filler. To me, Demi's upper lip looks a bit fuller than it did in the past. And there's a lot to say about 2021 when Demi's 59 years old. First, I see some signs of a potential brow lift revision. For many years, the brow lift that she may have gotten much earlier in life, around age 24, has held up for decades, it seems. And then with the slight descent of the brows, it looks like she may have had them re-lifted. I'm also seeing some evidence of a potential facelift procedure. When I look at the sideburns, it looks to me like the hair is partially gone. You can see the level of where the hair is starting. It matches up a little closer to the lateral canthus of the eye, whereas in the past, it was definitely extending lower than that. And we know that with facelift surgery, some of that sideburn hair can be lost. And sometimes we can do a hair transplant to actually bring some of that hair back. And it can also cover up some of these scars. and we have a YouTube video on that subject. Also, I'm seeing some changes to Demi's tragal region. As we talk about in many other videos about facelift surgery, oftentimes the tragus and the skin in front of it just appears different after a facelift surgery. And some of it can be that the tragus can be in a shotgun type of configuration. As the skin stretches back, you can get a pull on the tragus, kind of opening up that region. And other times you have extra skin that's laid over the tragus, so it kind of looks like a bit of a pancake type of appearance in front of that tragus. So I'm seeing some of those changes here. It also appears that some of that cheek filler that she's been getting over those preceding years has really built up, and so now there's basically an elimination of the perioral boundaries. So the mouth region that's supposed to be separate from, say, the cheeks is now a kind of a fused zone, and so you don't see those clear boundaries. And something else that I'm seeing here is that as the cheek starts to come down towards the perioral region, it starts to weigh down on the lateral portion of the upper lip, and that can bring the corners of the mouth down, increasing also the upper lip arch. We have a video on frowning and things that can make the mouth appear more frowny, and this is a more rare type of cause, I would say, where the medial cheek filler is starting to extend into essentially the upper cutaneous lip, creating a bit more of that arched appearance. In 2022, at the age of 60, I think that perhaps Demi is starting to reduce the cheek filler volume that she had, and this is giving her a bit more of a natural appearance once again. And in 2023 and 2024, I don't see any other major changes. The total cost of these potential facial plastic surgery procedures is $285,000. What's your take on Demi Moore's facial evolution? Do you think that it's mostly the result of natural aging or of plastic surgery? Let me know in the comments below, and also make sure to include which celebrity you'd like me to cover next.